right. So glad you all decided to join us for starting the conversation, talking about drugs with youth. I'm Amy Shea Reyes, she, her pronouns. I'm the Behavioral Health Manager for Children, Youth, and Families with CareOregon, and I'm really excited and happy to introduce our next guest, Stacey, who you may have seen a few minutes ago, who's going to have this great conversation with us. There's plenty of room if you want to move around. Please come in and have a seat. Stacey.
Thank you. Thanks, guys. Yes, I was already introduced a little bit ago, and to echo sentiments, thank you so much to CareOregon for bringing us all together and being in this collective space. I know that my spirit just thrives in these spaces by collecting with all of you that we're doing this work together, and it's invigorating work and it's really challenging work, and that we are all learning from one another is so important. I also don't think that, I just happen to be the guy that put the slides together. I think that any one of us could have been up here having this conversation. So I hope that we can have a conversation over the course of the next hour about what you all are learning too. By no means am I the expert here. I'm sitting amongst experts and can hopefully continue to learn from one another. I don't have any financial disclosures, but I did want to just start by sharing a little bit about myself. I come from a family tree that's roots and branches are filled with the experiences of others with trying to navigate and survive, and haven't been able to survive the impacts of substance use and their mental health needs. And being a part of that family system has really informed the path that I have found myself professionally working in the co-occurring field of mental health and substance use. You guys heard from me earlier, I am a LCSW, so the role of social work really is embedded in my being. How I approach people in the world around me is grounded in those tenets of social work, people having autonomy for themselves. And each individual's needs are their needs alone. And also a CADC, so certified alcohol and drug counselor. And then I'm also a mom. I have 2 middle school students. I have a 6th grader and an 8th grader. I tried to kind of be the cool mom for a little bit, but then that wasn't working. So I leaned hard into just being my weird, awkward self. And I think that that's working a little bit better because it's more comfortable for me, not for them, but my hope is that it's going to build character for them as they get older. And then also my role currently is as school therapist at Harmony Academy. Harmony was started in 2019. It is our state's first recovery high school, but I think, like I had said earlier, we are so fortunate that Rivercrest through MESD opened up this fall, and there's some hopefulness and planning moving forward with our state to get some more recovery high schools opened up here shortly. And I highlight all of these things, but particularly the last 2, to just highlight that I am having these conversations every day, as I know you all are as well, but both as a mom and as a professional, and that those lenses are continuing to inform the work that I do. What I hope that we can have at the end of this hour together, some of the takeaways are that, again, this is work that everyone is doing, so it's not building new, or it's not like getting these skills for the first time or having these thoughts for the first time, but it's really strengthening to incorporate moving forward what are the ways that we can engage young people in conversations around substance use, strengthening our own comfort in having these conversations. And then really pulling from the what I like to reflect on the golden thread of themes that we're having not only 2 weeks ago through this learning series that CareOregon has put together, but the work that we're all doing, what learning series will come forward. And then I don't know if anyone else had the opportunity to be earlier in the month down in Eugene. OHA had put together a conference as well. And as I was pulling these slides together and as I've been sitting in these conversations, I know that I'm pulling these golden threads of the topics and ideas, the challenging dynamics, the things that are working, pulling them all together to implement what we're doing now and supporting the young people and families that we're working with. Okay, so to give you the stitch of that first golden thread, this already came up again this morning. Lydia gave an amazing presentation 2 weeks ago for those who were able to be here. We could spend all day talking about stigma, shame, and secrecy. She barely touched the tip of the iceberg in having over an hour, and I'm gonna spend maybe 3 minutes on it. But just acknowledging that stigma is so prevalent in not only substance use, but mental health. And I really don't want to separate those two, that they work in tandem with each other and that we're talking about both at the same time. And so acknowledging that there are these larger societal dynamics of stigma at play, there's the individualized and family dynamics, and sussing out for any young person that you're talking to, sussing out the family system that they come from, what is their understanding and experience with the stigma, shame, and secrecy around substances. If you haven't had a chance to look at the Words Matter, I know that got put out there 2 weeks ago, that it can be a really helpful document to just ground us all in common language around making those efforts to reduce the stigmatization that we experience. And then on the opposite side of that same coin, the stigma exists and the shaming can exist around substance use, but we also live in a community and state that really glorifies a lot of substance use. Tony was just talking about this moments ago, that we have a state that capitalizes on a lot of substances, specifically our alcohol industry and cannabis industry. And so that can create some confusing dynamics for kids when we're talking about substances, that they have these negative effects and they are negative, but that also it's glorified and people are using it all around them. So just being aware of the ands that exist. Okay, and then finally, like, as you're heading into conversations with young people, taking that opportunity to reflect on yourself. What is going on for you? What are the conversations that make you uncomfortable? Where are the knowledge gaps that you have? What is your own experience with feeling stigmatized or holding secrecy or shame? When you are having difficult conversations or painful conversations, how are you taking care of yourself? And so much of this self-reflection and self-awareness allows us to really set that foundational stage for heading into any conversations that we're having with young people. As I had highlighted before, like, if I'm gonna be having a difficult conversation that's gonna be painful in some personal way, how am I gonna take care of myself so I can meet with the next young person in the next hour, and that doesn't carry over? I also just stole from Lydia last week because I felt it was really important to have cute dogs on a screenshot. I know I can't get over it. Yes, like, self-reflection is so important. And the other, I don't know how many other social workers are in the room. For those who aren't social workers, and then I will traumatize those of you who are, so much of our learning experience and education is to participate in what's called process recordings. And what those entail are walking into a room and reflecting and recording layers upon layers of the interactions that you've had, whether it's with an individual or a group. And that's not just the verbatim conversations we're having, but that's when I walk in, how is my body language affecting the room? How is that other person's body language affecting the room? When they say something and that's difficult for me to hear, what happens in my body that I need to find a way to ground around? So I would encourage people, I think it's a really helpful tool that is applicable to anyone having conversations with other humans, that it helps us reflect on, how am I saying something? And did I just say something that was super offensive and I did not mean to, but I can see their body reacting to that. And that gives me an opportunity to think back and maybe make a small adjustment in how I'm doing the work that I'm doing and carrying myself through these conversations. And then the final part of just setting this foundational stage of having conversations is the context of who you are having the conversation with. Is this a elementary aged young person, middle school, high school? So what is their developmental age? And then also, how are they processing information? Do they have a higher functioning capability or not? Do you need to be more concrete? But really looking at the individual, because that is gonna give you the opportunity to adjust how you are distributing information. And then where is the conversations happening? Is this in a group setting? Is this in a one-on-one conversation? Is this in a classroom for prevention education? Just thinking about the larger context is gonna help us allow to adjust to how we are presenting the information, how it's received, and why we're having this conversation. Again, are we in the role of doing prevention work and sharing general education and information? Or are we responding to a crisis because a student has had an overdose and we're needing to pull them into a conversation and support them with getting next steps of resources and care? And part of this context is also, what is your role? Are you someone who is in the role of a peer support specialist? Are you a medical provider? Or are you a behavioral health specialist in a medical health setting? And I offer that to say, what is also the scope and role of your work? We may be the first adult in a young person's life to be having this conversation with them. And once we hear that, who are we bringing into the conversation and support system to navigate next steps, whatever those may need to be? Can I just get a general understanding of who is in the room right now? Like, who works in a healthcare setting? Does anyone work in a school? Awesome. And then who's working through like a treatment program, like a substance use specific treatment program? Okay. Those are very broad areas of work, but are there other spaces that I didn't highlight that people are working in? Prevention? Care coordination. Oh, speaking to my heart. Transitional housing, okay. For the prevention work, who said that? Yeah. County Health, okay, awesome, thank you. There's no way we're not having one direct conversation about one setting. We're all working in different environments. I would imagine working with different ages of young people and adults, different dynamics at play. So this is just such a global conversation that we're gonna have. And I hope that all of you are taking whatever learning that is happening in this space back to your own settings and figuring out where are the areas for improvement, and really encouraging folks to have that brave space mentality. Like, these can be hard conversations. Sometimes our systems aren't working in the best ways to support the vulnerable patient populations that we're serving. And so what can we do to improve that? Okay. So some of the like nuts and bolts around this part of the presentation. What doesn't work? We have known for a while that scare tactics don't work. That's not to say that we're dismissing the dangers and challenges of substance use, but we're not leading with fear-based information and education. And then also the authoritarian and paternalistic communication. Thank you, Megan, for sharing your example earlier of just talking at people and giving them the NPR segments that are going in one ear and out the other. I've been collecting some statements from some of the young people that I work with and live with to just apply some of that narrative that reinforces the reasons why what does and doesn't work is at play. So someone who does have a substance use disorder and was reflecting on opportunities for early intervention that really missed the mark was telling me don't do it sure didn't work. So just that reiterating message of drugs are bad, don't do them, didn't provide opportunities for a deeper conversation when substance use did start. And then having someone interrupt a conversation and sharing a personal story that unintentionally, but still had the effect of feeling judgmental and shutting down the conversation. So this is a nice reflection for me as I heard it, that hearkening back to that process recording experience, right? So if I'm having a conversation with someone and I see them shut down, that gives me a moment to pause and figure out why that happened and to loop back around and start again. And we can always start again within any conversation. And then dismissing and shaming. And to me, this is one of the most heartbreaking conversations I've had recently, sitting across from a young person, and having them reflect that, remember what it's like being a kid. You have to make hard choices, and sometimes you screw up. Just because I made a bad choice doesn't mean I'm a bad person. I'm constantly learning from those mistakes. And these are kids. As humans, we're all presented with choices, options. We make a choice. Sometimes it works out, sometimes it doesn't, and we adjust and move forward. And when we're talking about substances, sometimes those choices and decisions just have really big consequences. And this person is reflecting that they felt incredibly judged and that their character of being a bad person was presented to them following an unhelpful conversation that they sat in. Okay, I'm gonna pause there. Tapping into my allied colleagues, what things have you guys experienced that haven't worked, where conversations have shut down?
I think obviously something that doesn't work is not approaching the appointment or conversation with some sort of confidence or hope that things can get better. So I guess what I'm trying to say is what hasn't worked for me in the past is saying something like, because I don't have any experience with treating substance use disorder, saying that, I don't have any experience with that. Let's figure this out together. But I guess what does work is having a hopeful and confident approach, saying, I know this is hard, the resources are limited, and we're gonna figure it out together. I guess what I'm saying is partnering more with them is the antidote for a lot of what doesn't work. I might be jumping the gun, I'm sorry.
No worries.
Okay.
You can set the stage.
I think in my experience, what doesn't work is siloing mental health or substance use and siloing the systems that are involved with the care, because that, especially for young people, becomes confusing to navigate. School wants me to do this, mom wants me to do that, doctor says this, treatment center says that.
Yeah, and I just told this one person over here, all of this information, and now you're asking me to repeat it, and this is really painful information. Do you not talk with each other? And I don't want to have everyone know my business. That conflict that can happen. Yeah, thank you.
Hi, I'm Wyman. I am a substance abuse counselor, and what I know don't work is tell them things that you can't produce.
Yeah.
Don't give them false stuff. I mean, be honest to them, because honesty in this field is very important to a child or a kid or a teenager or anyone. But just don't make promises that you can't keep.
That's right.
And then because you build them up, and then all of a sudden you can't do it.
Yeah.
So just be straightforward and honest with them.
Yeah, we're setting up that hopefulness or
Yes.
helplessness, and right?
Helplessness.
Yeah.
Yes.
Yeah, thank you.
I think in prevention, we think sometimes just giving people the facts is enough for them to make the right decisions about them. And it's hard when we're trying to just get in partnerships with different organizations that are youth engaged. We're just trying to provide them with something, and it's usually not necessarily like evidence-based, but it is getting in to get information out there. And so it's like, yes, it's a little success, but ultimately, if you're not building in more direct youth engagement to like hear from them, motivational interviewing wise, like what they're experiencing, I don't think the information that we're giving them is going to do anything, so.
Yeah, thank you.
Kind of piggybacking on that, I think also just sharing a list of resources without providing any assistance utilizing those resources
Not helpful.
at all. It's very overwhelming.
Yeah, I will share with you all, before I was at Harmony, I was at OHSU working with adults, sometimes young adults, but on a consult medicine service called Impact. And in the hospital system, that is happening all the time. We're just sending people with those AVSs who are living on the streets, and that very quickly became toilet paper as an access, right? So just highlighting the ineffectiveness of it. Anyone else? Oh yeah, we'll do one more and then we'll move on.
So I work with male foster youth, and so when they get to the transitional housing program that I work at, they've often been through previous programs like residential treatment centers. And so I think that when I have these conversations with them, it's still very new to me to be talking to them about this, and so obviously I'm learning. But I think that it's really a fine line to walk where we don't bring up treatment right away, because the idea of going back into a therapeutic setting in any capacity, even if it's not talking about necessarily their trauma, it can be really triggering for them. And so trying to approach it in a way where it's we're gonna work together on this and we're gonna do what's comfortable for you, but also helping them understand what their options are.
Awesome, thank you. So bringing up the what doesn't work isn't to shame or blame any of us, oh, you used a scare tactic. We are all doing this work and learning. If I think back to the early days and years of my professional work, I guaranteed did all of those things. When I think about the conversations I have with my own children, I absolutely will play the NPR articles and segments. We are gonna do this. We are human and we are engaged in often really difficult work, but it's how can we tap into the collective we to learn from each other, and what are the things that consistently are creating the barriers so that we don't have to keep recreating a wheel, and tap into what we're finding the benefits to engage around these conversations with. Okay, so let's talk about some more of those positive things and the things that we are finding are helpful, and work to just open the door and get in to have the conversations in the first place. We have to be trauma informed, and again, I know that I'm not the only one who knows that in this room, and that you all are practicing that. we also work in settings that are not trauma-informed. And so being aware of, when we talked about that context, the who, what, why, where are these conversations happening, and to what extent? And are there ways that you can increase the trauma-informed space to have really difficult conversations, and oftentimes uncomfortable conversations, not just for the young person, but for us. I do have a story that a young person shared with me. They were in a psychiatric hospital as related to their alcohol use and their co-occurring mental health needs, and were sitting in their room getting ready to have a conversation with someone that was going to be, they knew, a really difficult conversation, and the door was ajar, and they could hear the staff talking about them outside the door. And we know this happens. It's not about talking negatively about someone. For those of us in quick-paced jobs and settings, that we might grab a colleague real quick and say something in a quick conversation, not knowing or not being cognizant that that's not the space to do it in, to pull each other into confidential spaces, because that's the kind of stuff that can happen. And created a barrier that students shared, that they didn't do anything during that hospital stay except sit in their room, because that moment really set up a huge barrier. And then we should all just assume that everyone has survived some kind of trauma, and acknowledging, especially if we are working with young people farther along that continuum of their substance use, they're experiencing more consequences. They likely have SUD, that there is a high prevalence that they have a pretty significant trauma history. And so giving them space and time to engage in the conversations. It's not a 50-minute conversation. It can take hours and weeks to build up that trust, to engage honestly and genuinely. And then the next piece is just coming in from a place of pure curiosity. What is the person across from you? What are they seeing and hearing? What's going on in their school? What's going on in their house? What's going on in their community? They're going to be teaching us a lot more than we might be teaching them. Because the information that they're giving us is going to help inform how we engage with them and move forward, whether it's connection to treatment, whether it's further prevention resources. And this is where, again, the next stitch of that golden thread, because it already came up earlier this morning, is the use of motivational interviewing. And there's a lot of clinicians in this room, and so I don't doubt that everyone has a wealth of experience and knowledge with MI. If you don't, or you're looking to expand upon it, in my resources I have a couple links. There are so many opportunities for continuing that skill set, and practicing it is the only way we continue to improve it. But the spirit of MI brings that curiosity to conversations, and helping elicit from any one individual what they want, what they need, and what some of the challenges they might be experiencing are, to consider some behavior changes. And then just a couple other quotes. Just have a normal conversation. Be chill. Don't talk to us like you know more. I think that really highlights that young people, and these statements are all coming from adolescents, so I want to acknowledge that age. But they are the experts of their own life. And we can have the and conversations. We should be having the and conversations, that they are young people. They have a lot of growth neurodevelopmentally to happen still. And in this moment, right now, what they know is what they know, and what they feel is what they feel, and that is their truth. And tapping into that and tapping into their expertise is really important. And then it's confusing. You say, don't do it, and then social media glamorizes heroin chic. I'll tell you guys, I'm a lady of a certain age, and I did not know that heroin chic was still something that they were saying, but I did not pull this from my youth. This is something that still is being talked about and referenced, and highlighting what is being presented on social media, really the glamorization that comes with substance use, and that's confusing. And so to be in those curious and real conversations, what are you seeing? How are you making sense of that? That sounds really confusing to hear. Substances are dangerous. These are the consequences that can happen, and see someone glorifying it and being elevated for that glorification. And then the final quote, which I think pulls in that trauma-informed lens as well as just being curious about what's going on for someone, is that I sat with a young person who shared with me, I was in a situation every day that was giving me PTSD, and substances were how I was staying alive. I tried to talk about it with people, but they just didn't take it serious. So rather than why are you using substance, or not even why, like stop using substances, it's bad, this is what's happening, why are you using substances? What are the benefits? Like, what are you getting from that right now? Because if it was all bad, it's easier to not engage in that activity. There's still some benefit, and we have to be curious about that. And then being direct and honest. And I think that this was already shared amongst many of you with the things that don't work, is making those false promises or hopefulness statements. And I don't know if I can get you into a treatment program. There's limited resources. Your insurance limits that. And what can we do to support you where you're at? But being direct about what some of the challenges are really important. And then also, this statement highlights, when we talk about use disorder, that's really embedded in the cravings, consequences, compulsions that happen around use, right? And so if someone is having intermittent use, are they experiencing any consequences of that yet? And what might that look like? To have that reality check around it. This doesn't sound like occasional, in the setting of adolescence, experimental use, that this is moving towards really problematic dynamics and what someone might call a use disorder. And this young person had shared with me, I just needed someone to openly talk about what's not normal, like drinking alone. So giving some concrete examples that can be relatable to them to help structure and frame, rather than saying, are you experiencing consequences? Well, what do those consequences look like? We can highlight and name more specifically. All right. So once we get that door open, how do we keep it open? Making sure that we are bringing our genuine self into the conversation, and that can be challenging depending on what our role is. Are you a peer support specialist is going to walk in with their genuine self because that is the secret sauce of the role. But for someone who is in a more clinical role, we might have to set some of those boundaries, and practicing how I still exude who I am as an individual, so that connection can happen with keeping my boundaries, takes work. In the panel this morning, I was thinking about this slide and thinking about Tony showing up in the way he does. And I don't know who else has seen Tony in different spaces or places, but Tony is Tony wherever he is. So he is going to show up as that person in any space. And the more that we can tap into feeling comfortable with showing up as ourselves, knowing that we're going to have conversations that may create discomfort or be challenging, and navigate that, we just continue to show up, and that is relatable, and that is a generalized human statement. I think we can all acknowledge that for any relationships we're making. And you can read those quotes about students who just had highlighted how they have experienced that. And then I think it's really important to express gratitude for anyone being able to participate in the conversations that we're having. Again, these may open up doors into people's personal lives that they haven't talked with anyone about before, really painful and embarrassing things. And so if we can acknowledge that and express the gratitude that we are having for that individual and humility that they allowed us to be on the other end of that conversation, I think that goes a long way to keeping doors open. And this is a very poorly worded last bullet, but really just acknowledging that we are all participating in a similar process. We are all learning along the way as our professional selves, and that I might make a mistake one day and say something that came out in a way I did not intend for it to come out, and owning that so that I can keep the relationship and conversation going. And really we're modeling healing in that way too. We're modeling that mistakes happen and they're, if we can repair them, that is part of the process. And I think that one of my students named it better than I can. Just own it if it happens, and that's okay. Okay, I want to hear from you guys too. Anything that I didn't highlight up here that you guys have found?
Letting kids educate you. Mm-hmm. I remember sitting in a room with a kid and he told me he took 3 lines of lean, and I said, I thought lean was a drink. And he was like, it is, I mean the lines on the cup. And he was talking about kind of the ounces on the side of the cup. But me admitting I didn't know what he was talking about was really big for our relationship. And I was able to say, like, I know what this drug is, which showed my competence, but still allowed me to be educated on his experience of that drug.
Yeah, I love it. Thank you. And sometimes they're just hearing stuff too, and then making assumptions. And so it just gets us on the same page. So we're using the same language and understanding moving forward. Thank you for that.
Thank you, Stacey. I was wondering if you could speak to kind of the process of allyship with parent-guardian support. So bridging those conversations and any tips and tricks on preserving the autonomy of the youth while also delving into the very real probability that this addiction didn't come out of nowhere and that there may be some things that need to be addressed with other individuals.
Yeah, you're jumping the gun.
Oh, sorry.
But I really appreciate it. Thank you. Anyone else? Is anyone asking the young people they work with what works and what doesn't? What's helpful, what's not helpful? Ellen, you stay in the middle.
Hi, Stacey. So I ask this question all the time to all my folks that I work with. I find it's a critical part of my practice. I'm a SUDS-specific, MOUD-specific behavioral health provider in the primary care clinics of Multnomah County Health Department. And so I'm always curious about this. So the things that come up the most as far as the don't work and work, and some feedback that I get all the time is that you're like a real person. Mm. You are a real person, and and I think this goes to your statement about being genuine and showing up as yourself. Mm-hmm. That has been something that in my professional life I have been reprimanded for. I have been, people have attempted to suppress me being authentic. I curse. I am very frank and direct, and I'm very passionate. And those are things that our system has tried to extract out of me. But I can say that it is my most powerful resource in the room with all of the folks that I work with who use substances, but especially youth. And I think that it's really interesting how often things that I think are just very normal are like people are interacting with what they perceive as robots in a system, and there's a series of numbers. Mm-hmm. And again, there's so many different things that try to do that to us, and it's a disservice. And so I think that I think that just really want to highlight the genuine self, and then other things that especially youth tell me are like really effective is like knowing the reality. So, I think that it is pretty scary for a lot of people, and I talk to people all day long, providers, MAs, front desk staff, all kinds of folks in all of my meetings. I kind of, I'm treated as an on-site continuing education person for substance use. It's a pretty important part of my role because people are terrified of talking to, one, adolescents in general. People are very afraid of teenagers. And I think that they know that. All folks that we work with, and our own selves, when you walk into a room with somebody, within a few seconds, how they feel about you, what they think, and whether or not they're safe. And people are making these microsecond decisions, and I think that people being able to just acknowledge that they're afraid, that they're literally afraid to talk to teenagers. They're literally afraid to talk to teenagers about using drugs, and acknowledging that, and then practicing it, and working through it, and saying you can't. We're people are dying because of our discomfort, and that's unacceptable. That's where I get a little overzealous. But yeah, so and I'm rambling now, but I think that I just have a lot of gratitude for this whole learning series, and I know that it's overdue, and I know that this is the very beginning. We're just barely scratching the surface in all 4 of these sessions, and so I just want to encourage every single one of you in this room, make it a goal to do a training at least every year. Make it a goal to connect with your colleagues frequently. Have a group of people that you trust and respect, and talk about how we're going to do a better job all together, providing services and advocating, and what I think what Tony really does an incredible job, no matter where he goes, is looking at the legislation, know what's going on in the state and the county, and the people who make decisions, look at who's on your school boards, and care very deeply about the people who are in power, because on every single level, that is where most of the decisions happen, and we have to care, even though we're exhausted and terrified and all those things. We have to care. Okay, sorry.
Thanks. Go ahead. We'll do one more.
I can be fast. Related to being genuine,
Yeah.
and that sort of thing, I just really think it's helpful to tell people that you care. And for a lot of people that I work with, sometimes my care is the first time that they felt like someone cared. And so I just think that's really important to, not make it about you, of course, but, check in. Be like, hey, am I going to see you on Friday? That sort of thing. Or they don't come on Friday, and then you see them next time. Be like, I missed you on Friday. You're tracking them, you care.
Yeah, and thank you for bringing that up, and being mindful that that's not just word service, right? Saying, I really care about you while I'm distracted, typing a note somewhere, not making eye contact, our behaviors, and even you didn't say I care, but saying when am I gonna see you next? That is the implication of, you're voicing that in other ways. And so thanks for highlighting that. Yes, that we care about you. Yes.
That has been very effective for me, that it's kind of in some ways surprising, but in some ways it isn't, is that bringing in the family has had a really positive impact with my working with youth.
Thank you. Yeah, we're going to move on towards that then next. That's a good segue. Again, I'm going to keep stitching the golden threads for us. That if we're going to think about being genuine and being our genuine self, but remembering about the self-reflection and what is maybe some of the difficult scenarios for us to walk into, do some of that work outside of here, like project what a difficult question might be, what a difficult scenario might be, and practice that, like tapping into how you would respond, that it's not a robotic response or a cookie cutter response, but it's how you would say, yeah, people are dying all around us. Our state is in the media as being number one in areas it shouldn't be number one in, and number 50 where it shouldn't be number 50 at. And how you convey that based on how you are is so powerful, because it's gonna keep people engaged. Okay. I want to bring up the positive childhood experiences, and I don't know who else is familiar with this framework. I would assume that everyone is very familiar with ACEs and a pair of ACEs, which is the adverse childhood experiences and adverse childhood environments. And we know the risks that come with high ACEs and probability of developing significant substance use disorders and mental health treatment needs. But what happens in conjunction with the ACEs is the PCEs. So the positive childhood experiences are the protective factors, and that what we know is that these protective factors, even in the setting of ACEs, have a compounding effect to reduce some of those challenges and negative outcomes. So there's some studies out of Johns Hopkins and I think it's Tufts. Again, these are in my resources. But who in a young person's life do they have an ability to talk about their feelings with? Sorry, I'm just gonna move over here. It's a little fuzzy from this side. Do they have family who is supportive? So again, we're talking about these themes of family support systems. Do they enjoy and participate in community activities and events? Like, what are the pro-social activities and spaces that they're connected to outside of their families? Are those sports? Is that church? Is that the recovery communities? Where is, again, the warm hug that's pulling around our young people? Do they have a feeling of belonging in their school environment? Do they feel safe and protected by adults in their home? Do they have at least 2 non-parent adults who they genuinely care about? And do they feel supported by friends? So I say that for a couple of reasons. One, we should be thinking about it. This should be embedded in our conversations when we're talking about substance use, is that we should also be thinking about what are the protective factors that are in place for our young people. And even if they've already started down a pathway of substance use, making sure that they have these protective factors in their life is going to provide potential change for more negative outcomes further along the line. And all of you in this room have the ability to be the non-parent adult in their life who cares, to bring up the comments of caring and to start spreading that network out of knowing that there are others who can care about them in their lives. And then a big piece of this includes families, right? And so what do families look like? And what are families' needs that are happening? So we do need to engage parents in the conversations or caregivers, when in the conversation when we're talking about young people, because that's who's legally responsible for them and who they are dependent on for a whole bunch of needs. And if some of the same things that apply for talking about young people are going to apply for having conversations with families. We need to be curious. What are the stressors in any one family's system? What are their values? What are their positive strengths and attributes, and what are their challenges? So that we can be individualized in responding to the needs. Are they worried about their kids? What have they tried? What has worked? What hasn't worked? So just holding that curiosity to open a door and keep it open for conversations. This may be a family system that has had our larger like DHS or DCJ. There might have been some punitive systems in their life. And so it's scary to talk about things that might be going on for fear of repercussion and larger consequences. And then any conversations that we're having that can distribute resources or education, like what information, generalized information, are we sharing with young people around statistics or generalized knowledge, that so we can make sure we're speaking the same language, that the conversations that we're having with the young person can become the conversations that are happening in the home environment too. And Tony, I think to your question, like being really transparent with the young person, though, like you're bringing something up, I think it would be helpful for other people in your home to have this information. Are you okay with me sharing that? Again, seeking that permission. If they're not okay with one piece of it, are they okay with another piece? Where can we start wedging the door open? It may not get flung wide open, but where can we start? And just all of that can create these opportunities for communication partnering, which is so incredibly important. Okay, so the golden threads that I hope that I was able to start planting today are really as much as we can to maintain this awareness of stigma and shame and engage actively in the conversations, not only with those that we are supporting and serving, but within our organizations and larger community, to reduce that. To be curious, authentic, and to continue to engage in your own self-awareness and own education. Ellen, you pulled the golden thread for me by just acknowledging that too. Like this is a fantastic learning series. It's pulling us together in these spaces, but learning is happening all throughout our community and nationwide. And so what opportunities can you give yourself to do that? And continue to ask for and include the perspectives of young people. Like their voices are what allow us to keep showing up and supporting them, and hearing what they need from us is so incredibly important. And then I just want to say thank you all. Like we are truly in this together. Like I said, I just happen to be the person standing up here. I don't doubt that any one of you could have been up here and providing different and helpful perspectives. So thank you for letting me be up here, and I really appreciate all of you and doing this work together.